I think in listening to it, as the critic for this file, I've had the opportunity to listen to thousands of parents and families. And I think what's really disheartening is that I feel like, Ms. Friendly, whether you intend it or not, you're really pitting these home-based entrepreneur, small business operated childcares against public. And I know my child went to a home-based childcare and it was amazing. So to say that they don't have quality, I feel as the critic, it is my job here to voice that they are absolutely quality people that look after our children. And I want that on the record. I'm going to turn to Andrea, if I may call you that, Andrea. In your comments, you mentioned the risk of creating a system that offers more bureaucracy than care. Can you explain to the committee what you mean by that?
Sure. I would argue that it's already happening. So the data collection and reporting requirements under the CWELC program are pretty labor intensive for childcare licensees. And I've talked with a lot of licensees about this, and the consensus seems to be that at minimum, so far, the CWELC is taking about 4 hours of a supervisor's time every week, just for the paperwork related to the CWELC. So that's over 200 hours per year that could have been used to help support frontline staff or work directly with the children. And I guess if I can actually quote one of our own operators about this. And what he was saying is that the impact is that the time I would normally use running my daycare is now dedicated to reading government memos and responding to demands for data and reports. It used to be that I would get emails from my staff with room inspections, playground inspections, and so on, and I would either send them a quick note to thank them for keeping up the quality or stop by their work areas to go over any issues they may be having. Now I can't do that. I don't have the time. I'm stuck in the office rather than interacting with staff and families and being able to monitor quality and equipment needs.
Thank you. Thank you for that. And I think, it does take a village to raise a child, as we've said multiple times. And I think it is all hands on deck that we need here to work together. The CBC recently reported 16,000 kids, the YMCA, 16,000 kids are enrolled in its 35,000 licensed spaces. That means there are 19,000 kids who don't get access to care in the YMCA of the GTA. Every new center that opens or gets renovations money to create more spaces seem to be sitting empty or not sitting at capacity. Do you think the quality is going to be compromised in combination with what Andrea has just told us of making this bureaucratic? And I would like to direct this to Ms. Ferris.
Do I think that the quality would be compromised in what capacity?
With the way that the bill is currently written, do you think that quality will be compromised for childcare and accessing childcare?
I genuinely worry about the ability to provide quality care if we don't have the workforce to support and sustain it. And I keep coming back to, in all my commentary on this, is it's all about the workforce. And currently we are in a staffing crisis. We have an incredible shortage of staff in the area, and that's why we can't create spaces either. So yes, I do worry about the impact on the quality if we can't get the staff that we need to support these programs.
Thank you. Andrea, if I can go back to you, could you give an example, or is there an example of another time in a government program designed to increase access to childcare has actually resulted in center closures?
Yeah, actually, I would say that happened when the province of Ontario rolled out its government-run full-day kindergarten program in public schools, so FDK. So prior to that, a lot of Ontario families relied on licensed childcare centres to provide kindergarten programming. And in the first 5 years of the full-day kindergarten rollout, which moved a lot of the kindergarten programming into public schools, Ontario lost more than 1,000 licensed childcare centres. And those centres provided childcare spaces not just for kindergarten-age children, but children in all age groups. And it seemed like that smaller not-for-profit centres were actually the hardest hit by that.
Thank you so much, Andrea. And to Ms. Ferris, do you feel that the way the bill C-35 is currently written, that it could create a two-tiered system of childcare, because basically those who are lucky enough or have won the lottery have a spot, but for those who are waiting, do not?
Yes, I definitely do have concerns that that exact system could happen. As I've mentioned, there are so many children who sit on the wait list and do not have a space, and there are operators who have chosen not to opt into CWELC and can therefore provide or offer spaces to those families. And yes, that would absolutely create a two-tiered system. Children or families who could afford to pay for more expensive care would be able to do so, and families that can't may get substandard care, unfortunately.
Thank you.
I do feel that this bill has the opportunity, though, to support the not-for-profit sector in securing and building better spaces.
Thank you so much. I guess quick yes or no answer to all three of you. You can just shake your head yes or no, I guess. Were you all consulted by the government in sort of how to improve or create a national workforce strategy to meet the demand of the labor crisis in early childhood educators? No? None? All, just for the record, none of them are saying yes. Thank you.